Hi, I'm Dr. Lutz.
And I'm Dr. Massah, and we're the husband and wife team serving the Restorative Dentistry group here in Brighton, Colorado.
I'm a general dentist.
And I'm a prosthodontist.
And today, instead of talking with patients, we're going to be talking with each other about a variety of different topics.
Let's get into it.
Who is more picky about their own teeth?
Yeah, for sure.
Who gives longer explanations to patients?
The treatment is longer and more complex. And I'm a better communicator.
She uses too many words.
Communication is key.
Okay.
Who takes longer to treatment plan?
No question. No question.
He's
Just
slow.
You just take my time. You just take my time.
Bigger perfectionist.
Oh, 100%. No doubt. No question. Me.
I'm not going to argue.
Who has better cheers bad manners?
Oh, wow. Both of us. Come on.
The general dentist is going to be asking the prosthodontist a couple of questions.
And I will be asking the general dentist questions from the prosthodontist perspective.
When do you think a GP should make the decision to refer to a specialist, a prosthodontist?
That's a good question. I think it depends on that general dentist's knowledge and training, especially with additional CEs. If they feel a case is getting to the point where they're trying to put pieces of a puzzle together and they're not sure what the next piece is, then I think that's about the right time. What is a patient expectation of GPs that might not be realistic?
Sometimes people come in and they have a single tooth bothering them, and then they have a lot of other things going on as well throughout their mouth. And sometimes it's hard for the general dentist to decide whether does this patient want this one area focused on, or do they want a really more comprehensive plan. They have a lot of dental needs. They have a lot of things going on across their mouth, and to truly sit down and treatment plan and talk to them about all their options, it takes a lot of time. And sometimes they want that done in just a couple of minutes. What makes a restoration fail in your eyes?
So what I always tell my patients is there can be many things that lead to failure, but ultimately, if the foundation is flawed, you're going to have restoration failure. And the way I break that down is my house analogy. You don't renovate a room in a house when you just found out that your foundation of the entire house is in trouble and everything is about to fall apart. Do I, as a prosthodontist, overcomplicate?
I think one thing that I've noticed, but it's not necessarily a fault of the prosthodontist, is that if there's a lot of options, it's hard for the prosthodontist to decide what option fits the patient best. And that can get very complicated because there's a lot of options and it takes a lot of time to discuss each option. If prosthodontics wasn't a dental specialty, what other specialty could you see yourself going into?
I have a high level of respect. Not that I don't have respect for other specialties, but very high level of respect for periodontists. I think just tissue management in general as a prosthodontist is something you're always concerned about and want to perfect. So I would be on the other end, making sure tissue and foundation is great. When do you know that it's time to refer to me?
This happens on a daily basis. And if I feel like I can't sit down with a patient, if they have extensive needs and I can't sit down with them to dedicate a lot of time to go over all the options, or if it's more complex involving the whole mouth, I refer to the prosthodontist.
Fair.
What's your biggest pet peeve when it comes to restorative work?
My biggest pet peeve is lack of communication when there's a multidisciplinary approach going on between multiple specialties. I think communication is so crucial. Do you ever wish you specialized? And if so, what specialty?
I don't think so. I like, as a general dentist, I have the ability to kind of find my own niche and do what I like to enjoy. And however, if there was a field that I would want to specialize in, I would probably say periodontics, just like her. What's your favorite thing about working with?
That kind of goes back to one of the previous questions. I'm very big on communication, and I think being able to work with someone that you are so close to kind of just takes that worry out of my mind, and there's no stress in the background about it at all. And what's your favorite part about working with me?
Because we've been dentists for a while, but we've never really worked together. I think my favorite thing is that typically when we get home, we don't talk about dentistry too much,
No.
which is probably, it's good. But to see all the advanced training she has and to learn and see all the cool things that she's learned and she's able to do that I'm not able to do, that's probably my favorite part.
But I also learn a lot from him. I think general dentistry is the hardest thing out of all the specialties.
Here we go.
And now for my favorite part, some myth-busting true and false questions.
Crowns last forever.
False.
False. Was that supposed to be synced? Nothing lasts forever.
It's true.
Implants are better than natural teeth.
False.
Depends.
Oh.
Depends the condition of that natural
That's true.
tooth. If it's a very weak or worn down and it's non-functional, then an implant is going to work better.
I agree with that.
Veneers ruin teeth.
False. Bad dentistry.
Kind of goes back to what you said earlier. It depends on
The condition.
the condition of the underlying tooth.
And if it's bad dentistry or not.
Yeah.
Very technique sensitive.
You can always just redo dental work.
False.
You do redo
I mean,
it.
sometimes
It's a very generalized question. You can really expand.
I think patients need to know that they should choose their dentist wisely, because when they go in for a procedure, it should be done as well as possible the first time to prevent that. Because sometimes it's a lot harder the second or third time.
So that's good. It depends on the procedure too. It gets a little tricky when you're starting to get into redoing root canals. But let's say we need to redo an implant. I would say higher success rate.
All dentists are trained the same.
False.
She's taught at different universities, and we
Yeah,
know
I think
ours
it depends on the school,
for sure.
the curriculum.
Saving the tooth is always the best option.
False. If the tooth is super compromised,
Yes.
it's best probably not to save it. It can be saved, and as long as there's clear expectations about what to expect, then it's okay. But in general, if a tooth is really compromised, it might be best to remove it.
If flossing makes my gum bleed, I should just stop flossing.
False.
False.
Definitely false.
Healthy gums don't bleed. Keep flossing.
There we go.
If my tooth doesn't hurt, it's healthy.
False.
If you wait for your tooth to start hurting, you've probably waited too long.
Yes. When there's pain, that's typically the point of no return. Not necessarily, but a lot of times. That
Thanks.
means the tooth is in a lot more trouble.
Things have become more complicated.
Yes.
For sure. Do me a favor. If you like what you're hearing, you like that content, hit that subscribe button for me. We're trying to get to 14 million subscribers. Come on down to Brighton. Like and subscribe. Hit that like button. Hit that subscribe button.
Subscribe.